Hello, everybody. Good afternoon. I'm Dr. Deanna Minich. Welcome to another one of our thought leader conversations that we're having as part of the American Nutrition Association. What we're trying to do is bring to you experts that have unique angles into the COVID-19 crisis, into this pandemic, and perhaps provide some interesting angles into personalized nutrition. So today we have Dr. Leo Galland, who is a board-certified internist practicing in New York City. He is recognized as a world leader in integrative and functional medicine. He was educated at Harvard University and the NYU School of Medicine. He won the Linus Pauling Award for his trailblazing vision that created a bold new approach toward healing for thousands of doctors. And I'd also like to mention that one of the things that I know Dr. Galland for is his book, The Allergy Solution. And I must tell you, it's very difficult to find a very good, well-referenced book on allergy, and he has done it. And so I'd like to talk with him today about some of the nutritional, herbal, and even the food applications that we can bring into our everyday life for our immune system. Welcome, Dr. Galland.
Hi, it's great to be talking with you today, Dina.
Yeah, it's so great. You know, you are in New York City, so you're in another one of the epicenters. I'm in the Seattle area. And so I'd just like to ask you more of a personal question. How has this pandemic affected your daily life being in New York City?
We're basically quarantined. I am treating patients by phone daily and have been pretty busy because there's so many people who are impacted by COVID-19 or the fear of COVID-19. And so in addition to the people with chronic illness that I've been working with all along, I have a number of patients who are in this very difficult situation. They are sick. They have symptoms consistent with this infection. They don't really want to go to urgent care or an emergency room because they don't want to expose themselves unnecessarily. On the other hand, and some of them have been, and they've been told, well, we think you have it, but you're not sick enough to go into the hospital, so just go home and hydrate. And so they're at home, they're isolated. If they live alone, they're really isolated, but even if they have family, they've kind of they're locked away in one room of their apartment or house. So they're separated from their spouse, their kids, and they're really scared, and a lot of them are very sick. And the people that I've been in touch with have been actually in many different places, not just New York, various cities around the country, and a couple of people in Europe. So I've gotten kind of insight into how this epidemic is playing itself out in Paris and London. And it's not better than in New York. That's the first thing I'll say. So what I attempt to do is to check in very frequently with those patients, see how they're doing, try to make sure they're moving in the right direction, not the wrong direction, and give them advice based upon the research that I've done over the past 3 months into the biology of COVID-19 and what people might be able to do to be less sick if exposed to it.
So to clarify, have you actually treated patients with COVID-19?
Oh, yeah.
Yes, you're doing that now. Okay.
Yeah, I'm doing that. But these are not people that are in the hospital.
Mm-hmm.
These are people who are weathering this illness at home. And the remarkable thing about COVID-19 is that at least, roughly 50% of people who get infected with this virus have no symptoms at all. They are totally asymptomatic despite the infection. About 5% become critically ill and require intensive hospital care. And then there are a large number in between, and the percentage isn't really clear, and it may vary from location to location, who have varying degrees of illness, which range from fairly mild and they recover easily to quite ill, unable to get up and walk around, barely able to take care of themselves in terms of feeding, difficulty breathing, maybe diarrhea, but the fatigue being really, fatigue and shortness of breath being the two most troubling symptoms, I would say, and for whom this illness lasts for a while. And even with the best of treatment, it may not immediately go away. There's a tail to the illness. You get over the acute illness, then there's the question of recovery.
Mm-hmm. And so what are you seeing as part of your treatment strategy, and how are you advising those people who are more critically ill? What's in your therapeutic toolkit?
Well, where I started with this was to look at the biology of this particular virus. And it is unique. That is, there really has not been anything like this that we've seen. It's unique in two ways. One is the variability of clinical impact that I just described. And the other is the extreme speed and ease with which it spreads from person to person. Originally, it was thought to be about twice as communicable as the flu. It's probably at least 4 times as communicable. And the studies that are being done now looking at antibody testing in random samples of the population, there was one done in Santa Clara County in California and another done in the village of Chelsea in Massachusetts. They both showed much, much higher levels of antibodies to the SARS-CoV-2 virus, which causes COVID-19, than anyone would have expected. In Chelsea, it was 1/3 of the population. And I think if you do the math and just start with the number of people who we know have died from this, it's easy to see that there are already tens of millions of Americans who have been infected, the great majority of whom never knew they ever had this. So you have this condition that spreads very quickly, and it's the ease of spread and the speed of spread that is really what's shut down, what's brought the world to a standstill, coupled with the fact that the small percentage get really sick, and so everybody is afraid. Is that going to be me? Am I going to be part of that 5% that gets critically ill? And people not wanting to be in high-risk situations. Mm-hmm. So that independently of anything that states or governors are doing, there would be a natural shutdown just because of the fear and concern that people have.
Yeah.
So that's a unique sort of epidemiology for this virus. The virus is biologically most like the SARS virus, but it spreads much more rapidly than the SARS virus did. It's much more communicable, but it has a much lower case fatality rate. Mm-hmm. It's not nearly as lethal. So that's the combination that's put us in the situation that we're in now. So I started back in January when I realized that this is something that my patients were going to care about. They were going to have questions, and they were going to want to know, well, what can I do? Because I have the kind of patients that are not going to be satisfied listening to what the CDC tells them, which is wash your hands and go home. They were, when you come home, they were going to they're much more proactive. So I really started looking in depth at the experience of SARS and MERS, which was another even more deadly, but less communicable coronavirus, and which is not as much like COVID-19 as SARS was. And I started looking at the emerging data that was appearing concerning this virus, and it's a constant dynamic situation of change. So what I realized is there are 3 enzymes that are absolutely critical for the illness to occur and for the spread to occur. The one that's probably received the most notoriety in the media is called ACE2. And the main reason that's gotten noticed is because ACE2 is the protein that the virus uses to enter the cell. It attaches to ACE2 and it gets into the cell. Now, because there are drugs that may raise the level of ACE2, and I say may because it's not proven, there was a lot of ill-advised advice that came out saying, oh, these drugs are bad, you should stop them if they increase your susceptibility to COVID-19. That whole line of thinking, which was pursued by a number of credentialed academics, is totally false, totally misunderstands the role of ACE2 in this infection, and actually the way that the virus, what it takes for the virus to spread. But it received a lot of attention because on the face of it, it was a kind of simplistic but common sense notion. Oh, if you have more ACE2, you're going to have more virus. That's just wrong. What it takes for ACE2 to be able to interact, with the virus is a change in the viral protein. The coating of the virus, which has these little spikes that I'm sure everyone's seen in all the drawings that have circulated, that viral spike protein has to be changed. And what changes it is a different enzyme called furan, F-U-R-I-N. Furan is really what's important here because recent genetic studies indicated that there have been mutations in this virus that make it more sensitive to furan and to the ability of furan to allow it to latch on to ACE2. So we really need to understand this ACE2-furan relationship. The thing about furan is there's very little furan on the outside of cells or circulating around the cells. So it is the presence of furan, not the amount of ACE2, that is the rate-limiting factor for the ability of this virus to enter cells. Now, furan is a type of enzyme that is present in all cells, and it's received a lot of attention over the past 20, 25 years because it plays a role in promoting cancer and other infectious diseases. Furan is what activates certain toxins that may make people sick. So there's been a lot of interest in, is there a way to safely inhibit furan? And it appears that there is. So the furan and ACE2 are two critical enzymes in the spread of COVID-19. The third is what's been called the main protease, which is produced by the virus once it's inside the cell. And this damages the cell and allows the virus to escape and then go to other cells. And the main protease is also known as 3CL protease. And there is a lot of interest in finding ways to naturally inhibit the 3CL protease. And so what I started doing back in January was looking at ways to impact this biology without drugs through steps that patients could take on their own outside hospitals as quickly as possible. And the conclusion that I came with was that ACE2 is actually the hero. It's not the villain. We want to preserve ACE2. And what the virus does to ACE2 is it exhausts it. It wears it out. But ACE2 does so many vitally important things in the body, and every manifestation of COVID-19 can be traced back to the deficiency of ACE2 caused by the virus. So my first thought is let's find a way to support ACE2 with natural products and to choose those that are not going to aggravate the situation in some way. Because when people get really sick, you don't want something that's going to be an immune stimulant. What everybody has been finding throughout the world is that the really sick people suffer from an overactive immune system, from what's been called cytokine storm, and there are particular substances. There's something called the NLRP3 inflammasome that plays a role in that. So you don't want to be boosting that. You actually want to be quieting that. So you need things that are going to support ACE2 inhibit furan, inhibit 3CL protease, and calm the NLRP3 inflammasome. Fortunately, there are a number of products like that. They've been around for a long time. They're very useful. Some of them have been thought about in the context of this illness, and some of them haven't. But those are the ones that I've tried to bring to my patients. At the top of the list for ACE2 support is resveratrol, especially combined with curcumin. Curcumin is an anti-inflammatory flavonoid found in turmeric. I'm sure, it's one of the best known and best studied. It actually works very well in conjunction with resveratrol. And resveratrol, of course, is the alleged anti-aging polyphenol in red wine. I don't think there's enough in red wine to do it, so you can't drink a quart of wine a night and hope to accomplish this, because it's not well absorbed enough. Quercetin is a very well-known bioflavonoid, probably most concentrated in onion skins, but found in a variety of fruits and vegetables, and has been used in integrative and functional medicine a lot, especially for its anti-allergic effects. Quercetin enhances the absorption of resveratrol. It's a 3CL protease inhibitor, and is actually being tested in China in clinical trials as a drug for treating COVID-19. There are about 500 clinical trials going on around the world with different substances. The quercetin research was done at McGill University in Montreal. It is being funded by a Canadian foundation, but it's being taken really seriously. So I really like those. The fourth substance is a flavonoid called luteolin. And when I discovered the role of furan, I'd already found out a lot about ACE2 and 3CL protease. The work, the link to furan was published more recently, maybe 3 weeks ago. And when I discovered the link to furan and the importance of furan and finding natural furan inhibitors, there were two that turned up. Luteolin was the first. Luteolin, like quercetin, is an anti-inflammatory flavonoid. It's found in a number of foods and probably most concentrated in celery. In fact, I wonder to what extent this celery juice craze that was kind of sweeping the country the benefits of celery juice might have been to the related to the content of luteolin in it. And it's found in a number of spices as well. Luteolin is well absorbed orally. It has very pronounced effects on allergy, which are positive. It stabilizes a type of inflammatory cell called a mast cell. It also turns out that luteolin inhibits furan naturally. And so that's a fourth component. And the fifth, andrographis. The andrographolides, which are the active components or alleged active components of Andrographis paniculatus, which is a Chinese herb, are potent furan inhibitors. And so those are really among the mainstay of treatments that I use. And for people, and then I kind of divide up the protocol, and there are some other components to it. Is somebody asymptomatic? That's where we start. Most of my patients are to begin with. And is that person in quarantine? In which case their risk of exposure is very low. So, let's just do the things to try and improve, to support ACE2 function. And maybe build up in your body the levels of those flavonoids that are going to be supported if you are infected. Because a lot of the flavonoids are very slowly absorbed and they need to build up in your tissues. If you're in a high-risk situation, that is, you have been exposed, or you think you've been exposed, or you have no symptoms, but you tested positive, then I would definitely bring in andrographis. And that's a situation in which elderberry fruit may be helpful. Of course, it's hard to get elderberry these days because there was an immediate worldwide run on elderberry when the pandemic struck. The problems with elderberry are, there are two kinds of problems. One is it is a very strong immune booster and actually has been shown to increase the levels of some of the inflammatory cytokines that you don't want when someone is sick with this disease. So it also works best preventively. So I think when someone's in a high-risk situation and you want to try and get ahead of the virus short term, I think elderberry makes a lot of sense. You need an elderberry concentrate that has a lot of flavonoids and that will tell you what the flavonoid or anthocyanin concentration is. Many of them don't do that. You don't really know what you're getting. There is one product that what I consider to be the best product is released by an Australian company. I found a compounding pharmacy in the U.S. that would encapsulate it and put it out, and have referred patients for that. The other herbal product that is a potent 3-CL protease inhibitor is called Houtunia cordata. It's used in a lot of Chinese herbal formulas. I used it in the past in the treatment of some of my patients with chronic Lyme disease. Very well tolerated, quite safe. It is anti-inflammatory, unlike the elderberry, which is pro-inflammatory. So whether or not people are symptomatic, I will put them on Houtunia. It can be a little hard to find. I've seen some really good responses to Houtunia. People who were like really sick, they had all the classic symptoms, hadn't necessarily proved that they had this, but within 24 hours of starting it, it was a marked change. So it's one of my favorites. When someone is sick, I generally am not putting people on it when they're asymptomatic and just, it may be at risk of, with a questionable risk of exposure.
Such a wealth of, yeah, please.
I was going to say that the quercetin and resveratrol and luteolin are all very safe, and curcumin, the front four that I mentioned, they're all very safe, and so I recommend that people start taking them preventively, even if the risk of exposure now is low, because eventually virtually everyone in this country is going to acquire this virus.
Yeah. What a wealth of knowledge, Dr. Galland. This is so important. And what I can really appreciate is a physician diving into the literature, looking into the research. One of the things that you have talked about, at least in your book, and you just mentioned it briefly here, is saying that people who fare the worst seem to have an overreactive immune system. Can you speak a little bit to the people who might have allergies? And so environmental allergies, food allergies, how does having an allergy template set the stage for something like COVID-19?
Well, so far that hasn't really been researched. There are theories about it. The thing is that asthma in particular may be a risk factor. But the risk factors that have been identified, and they were somewhat different in China than in the U.S. In China, the number one risk factor was high blood pressure, followed by diabetes, heart disease, and cancer. In the U.S., the biggest risk factor is obesity. And if you look at the people who wind up needing critical care or ICU treatment for COVID-19, obesity is the number one risk factor for them. Now, of course, obesity is a state that is number one associated with allergy. It's also associated with excess inflammation. And in the allergy solution, I explored the links between obesity and allergy and asthma. And actually, these cells called mast cells, which are inhibited by luteolin, they play a really critical role, because if you can block mast cells, you can just totally block the link between obesity and allergic inflammation, at least.
Fascinating. One of the things that I remember you talking about in that book is looking at teas, all the different types of teas because of their flavonoid content. And I really want to talk about this with you because I think it's everything, tea is pervasive. It's in all these different countries. It's something that we have accessibility to, even people who have financial constraints. So what can we be doing with even something as simple as black tea, oolong tea, green tea? Can we be bringing these in order to ramp down the inflammatory and or immune response in our bodies?
Right. Each of these teas actually has very distinct biochemical profiles with different biological effects or overlapping biological effects. As I discuss in the allergy solution, oolong tea is the most anti-inflammatory. Anti-allergic of all the teas. And that's because of its content of substances called theacinensins. Green tea, of course, is known for EGCG, but in the fermentation process that produces oolong tea and then black tea, you first get theacinensins produced. And they have the most profound effect in enabling regulatory T cells to do their job better and to downregulating allergy. Black tea, I recently discovered, has profound effects on 3CL protease. And once my work had sort of gotten out there, the COVID-19 work, started getting emails from what I'll call citizen soldiers, non-MDs, people that I didn't know, who said, hey, we like what you're writing. Did you know about this? Or I just discovered this. And that's amazing because what I've learned from them or the things that they've called to my attention have just been immensely helpful. One of them told me about the Montreal studies on quercetin and the research in China. Another one called my attention to the theaflavin galates in black tea as being potent 3CL protease inhibitors. Now, if you drink your black tea with milk, as the British do, you won't absorb the theaflavins. Milk interferes with the absorption of the theaflavins from tea. So you need to take it straight and probably pretty bitter and strongly brewed. But so in terms of what's the best beverage right now, if we're worried about COVID-19, it's probably a highly astringent black tea.
Mm-hmm. Wonderful. What a great practical tip. We are having come through a couple of questions. One is on wild blueberries. Did you come across anything in your research about blueberries?
Well, I love blueberries, and so I'm always looking for uses of blueberries. And they are profound. They have profound effects. I wasn't able to find anything on blueberry anthocyanins with regard to COVID-19 specifically, but what I will say is I review this literature almost daily, and there's always something new coming out, and it could come out tomorrow, it could come out next week. There are thousands of researchers around the world who are trying to find ways to help the world cope with COVID-19.
It's so true. In fact, I was just on PubMed the other day, and I think that there were 5,112 articles that had been published in this short period of time. This is unprecedented. There's so much literature out there. So, Dr. Galland, in close, what can we at the American Nutrition Association do in order to stay on top of the research? What's your process, and what are some of the ways that we can take that more personalized approach to nutrition, looking at the literature, thinking about our different phenotypes? How do we intersect the two? I know it's a big question to close, but perhaps you have some tips.
Well, I would love to see all of this experience, knowledge, and intelligence be used to try and understand nutritional approaches to inhibiting furan, inhibiting 3CL protease, and trying to understand and support the function of ACE2. For example, the way that ACE2 works is that's an enzyme that produces as its end product a peptide called angiotensin 1,7. Angiotensin 1,7 is responsible for almost all of the benefits of ACE2, and it is sorely lacking in people who get sick with COVID-19. Angiotensin 1,7 helps the body by attaching to a receptor called the MAS receptor, MAS receptor. Now, there are some natural products that directly stimulate the MAS receptor. Biocalin from Scutellaria biacalensis is one. It would be, I'm one person trying to comb through a bunch of literature, which is very detailed, and I always find it's essential to get back to primary sources. I can't tell you how much misinformation is present in review articles and secondary sources. I've never seen so many erudite professors misunderstand ACE2 as in the publications around just quoting the wrong facts and statistics. So I'd see something that I says, wow, that doesn't seem right to me. So I go and I go into original sources, and it isn't right. So, use your experience and knowledge and brain power to go to original sources, evaluate them critically, look for nutritional approaches. And I do think that furan is going to turn out to be the linchpin of this whole system. What are the natural ways to inhibit furan nutritionally to decrease the likelihood that this virus will be able to enter cells?
And it sounds like if we did have a handle on that, that would help us with other conditions like cancer, reducing cancer risk, potentially.
Yeah, anthrax toxin requires furan to be activated. There are infectious diseases that require furan. If you can find natural ways, and by the way, the natural ways that work outside the cell and in the circulation, most of the furan in the cell is inside the cell, bound to the membranes of something called the Golgi apparatus right outside the nucleus. It has no relationship to this virus. But a small amounts of furan become soluble. They travel through the cell cytoplasm to the membrane. They are present around the cell and on the outside of the membrane in very small quantities, but around all cells. That's the furan that we want to inactivate. So this should be a very safe and feasible approach.
Wonderfully said. My goodness, thank you so much for sharing a bit of your wisdom, your knowledge, and everything that you've been tracking over these past couple of months. It's been very illuminating and really practical for us to see what are some of the main plant actives. And it seems like, the beauty of plants and phytochemicals is that they have pleiotropic effects. So these are good for not just COVID-19 potentially, but for so many other conditions as well.
Right, and even in fighting this virus, resveratrol has, independent of its support for ACE2 and its anti-inflammatory effects in terms of the NLRP inflammasome, it has direct antiviral activity, which was demonstrated with the MERS virus. Luteolin coats the spike protein so that the furan can't cleave it. They all have multiple beneficial effects and a long history of safe use.
Yeah. When they all work together as a team, like you said, it's multifactorial. They're all coming in from different angles. Dr. Galland, thank you so much for being here with us today. Do you have any final comments before we close?
No, I think this has been a great interview. Thanks. I usually don't get the chance to dive deeply into the biology of this the way I'd like to. So I really appreciate that. Thanks, Deanna.
Oh, and we so appreciate it. It's been very valuable for our ANA community. So in closing, let me just say a couple of words. As most of you know, the American Nutrition Association is the professional home for the science and practice of personalized nutrition. And if you enjoy this interview series, what you can do is find some of the other recordings with experts that we've done. You can find them on their website, which is theana.org. Thanks again, Dr. Galland, and stay healthy and well, everybody. Take care.
Thank you. Stay well. Bye.
Bye-bye.